Hi. This dentist actually just had extractions and root canal, implants done yesterday. So why do I have extractions done on my two teeth, actually, two molars? Because when I was kid, I used to love candies so much that two of my molar teeth got decayed, and decay was really deep, and then it got to the nerve chamber, and then the root canal treatment need to be done. Now, along the time, this root canal treatment, I took the X-ray recently, and then I saw that there are infection start growing at the tip of that root tip of the root canal treated tooth. And this bacteria research has been shown that it's contained with so much harmful bacteria. So at this point, I had to make the decision. It's not an easy decision because I'm a dentist. I like to keep my teeth, as intact as possible. And then I don't have any pain. I don't have any swelling or anything like that. But that's the thing about root canal treated tooth, because you already lost the nerve around inside the tooth itself. The alarming system is not there yet. So when there is something harm, it just goes silently. This is what we call a silent abscess or silent infection. I try not to do uh, bone graft as well, because I'm thinking I just want to see if my body can just accept the implants with no bone graft. So fast forward 6 months after the extraction, it turned out to be that one of my side looks really good. My surgeon is actually complimented on how healthy the bone was, and then he got enough length and width so we can have the most the longest implant possible, so that we hope that this implant can stay really strong and stay long and preserve well. And but the other one, it turned out to be that I maybe during the treatment, some of the bone was missing and cracked. So I don't really have, I do have height, but I don't have the width. At that time, I decided that I have two options, placing a shorter implant or do some bone graft. But if I do shorter implant, then the strength may be compromised. So then I decided that I will take 3 or 4 months for the area to uh, receiving the bone graft to heal, and then finally, hopefully in 3 or 4 months from now, the other implant will be placed in a much better condition. So now I want to talk about the holistic way of extracting, and biological and holistic way to extract the teeth to ensure that we can have optimum bone health again. Okay. Now, around the teeth itself, there is something, there's a fiber, really strong fiber, connective tissue. We call that as a ligament or periodontal ligament. It's very, very soft tissue, but it's like a fiber, but it's really strong, that holding on our teeth and then give some cushion, between teeth and the bone. So our teeth is not just stay in the rigid bone, but have this like a shock absorber in form of this ligament, that ensure when you're clenching your grinding is not going to meet hard, with the bone, but there is some give going on. Okay, and that's why we can do orthodontic treatment because of this ligament, as can also absorb and being absorbed and also remade again. So that's a nice thing about this ligament. Now, however, when we do the extraction of the teeth, it's imperative that this ligament is also being removed out. Why? Because this ligament can contain a lot of bacteria also in there, and this can and then because this is like a ligament, like a membrane, that can prevent optimum cell to heal, cell all of the healing cells, to get inside and do the proper healing, complete healing. So removal of this ligament is very important, so we can have much faster and complete mobilization of our healing elements to heal that bone area in the most optimum healing, instead of halfway, or that can be because the healing is hampered. You can wind up with bone hole inside your bone, and that hole inside your bone again, you may not having any pain on that, but this can be a source of bacteria as well, to release the toxins, day in and day out. So that's why we have to pay attention as far as after extraction, removing that fibers. The next thing is, before even we decide to do the extraction, is to have supplements our body to ensure that you have enough nutrients, vitamins and minerals to help you to help your body to achieve optimum healing. And some of my patients, I recommend to have something called Denta Medica. It's just basically in one pill. This is contain all of the vitamins and minerals that you need to help your body to promote comprehensive healing. Also after that, 3 days, 3 days before, during, and 3 days after the extraction, I also recommend this Stella Life oral care recovery kit. I use it myself. So it consists of 3 things here. Okay, this is the mouthwash. There's no alcohol in it. So, and then this is all homeopathic, organic, made in here in America. And then this is the spray, and then this is the gel. Okay, those 3 things right here. We're going to put the link in the bottom as well. So 3 days before plant extractions, I rinse with this 3 times a day. I don't really have to put a lot of material, the mouthwash in it, just enough to soak your mouth. But you don't have to have the whole cup with this, okay? Just a little bit, but it's enough to soak your mouth, and then move around the mouthwash for about 2 minutes, and then you spit it. And then this gel right here, if your hand is clean, you can rub it around the area that is going to be extracted, the teeth that's going to be extracted. So basically get to here, and I just had mine yesterday, so this is my second time today to apply this. So Q-tip, and this is where I have mine. So basically just rub it around here. Okay, try not to touch the tip of, if you already put that inside your mouth, just a little bit right here. And then I have another one right here. So basically, I just rub the gel around the extraction site like that, and then actually it has minty taste in it, so it's really not bad at all. And then the spray, you're going to have 3 pumps under your tongue. Okay, you raise your tongue up. That's it. And then you can let it soak, because this is all plant-based, organic, and has a lot of healing properties in it. Okay. Now another thing that I do in order for me to promote the healing and also homeostasis of my mouth after the extraction is I'm also taking this probiotics. Okay, the same from the same company. I don't and disclaimer, I don't have any stocks or anything like that with them. I use them because I believe in their properties. So this oral pre and probiotic come also with the gut probiotic, pre and probiotic. Okay, so this is something that I take 2 times a day. And then this is in form of tablet that you dissolve inside your mouth. Okay, so let it dissolve. You don't want to crush it with your teeth, because this is the probiotic that that consists of our natural good bacteria. So that's why you dissolve it to let this bacteria, inhabit, occupy all of the rest of your mouth. And this good bacteria it's also can attract other good bacteria to grow, just like bad bacteria can attract other bacteria to grow. So this is can maintain a good homeostasis. Hopefully you feed your microbiome good microbiome inside your mouth, so it can be, as time you swallow it, you swallow good bacteria and also help with the digestive system and all that. And then this is the tablet for that. Okay. So that's as far as the supplements and also the care before, during, and after. And other things is make sure, well, during your healing, make sure that you don't spit too hard, okay? Because when you spit too hard, especially the side area, the blood clot that form, that it will change to become differentiate to become bone and gum, they can come out. So we leave that socket where your teeth was devoid of this blood clot, and when that happens, you can have something called dry socket, which a lot of my patients told me, some of my patients told me that they even more painful than having baby. I don't know for sure, okay, but that is that painful. That's why we need to taking care of this blood clot, properly. So no smoking, no alcohol, carbonated beverages, or rinse vigorously. Do not use straw because straw also can push uh, the pressure from the muscle can push the blood clot to be out. Okay, so yeah, so that's what we do here in our practice to have to ensure after the extraction we're going to have a good healing and successful healing. If this is extraction, the site will be ready for future implant placement. And then if this is implant surgery, with these procedures also help to ensure that your implant will receive well with your body and then can function for the years to come. Thank you so much for your attention. I'll talk to you later. Bye bye.